Hi, this is Henry Sanders back with another episode of Real Talk. We want to thank our sponsors at Park Bank. Thank you for everything that you're doing. If you want more of this content, make sure you go to our YouTube page and look at all the other Real Talk shows. Today we have our good friend back, Dane County Exec, Joe Parisi is back. How are you doing, sir?
I'm all right. How you doing, Henry?
I'm good.
Good.
Happy belated Mother's Day to your wife. So tell
Thank
her Master 365 says Happy Mother's Day.
Appreciate that.
So a lot's happened since we last talked,
Yeah.
I feel like. I mean, things are moving so fast. Malele passed away, who was a mother of the community. Mm-hmm. And, she meant a lot to us. For Malele, people like her built the foundation for organizations like Man 365 for us.
Yeah.
What do you have to say to people who are in the community? Because I know you knew Malele. And what do you have to say for people about the wonderful lady that she was?
Well, if we had more folks like her, huh? She just never stopped. Right up to the end. She was passionate. She loved this community immensely, and she turned that love and that compassion into action. And what I loved about Malele was, well, many things, but is she feared no one. She was completely dedicated to the cause, and she did it in her way, right? More like a marathon runner than a sprinter, and it was a long marathon. I would see her at an event, and she'd give me that look, and she'd say, and then she'd have a little conversation with me and tell me what I needed to know. So she will be missed. She will be missed.
Yeah, she is. And again, Malele was a mother to the community, a trailblazer.
Absolutely.
Someone who's unapologetic. Yes, and pulled all of our coattails at one point or another, I guarantee you.
And it all came from a place of love. She wasn't doing it for her. She was doing it for the community.
Always. Yeah. Always trying to figure out how to best move the community forward. Absolutely. And we miss you, Malele, and we want to say to your family our condolences. But you are missed, and we miss you, Malele. So tell me about you guys the county has $95 million you got from the CARES Act from the federal government. One, how did that work? How did you get $95 million from the federal government? What was that process?
Yeah, so part of that original CARES Act, the federal COVID relief, one of the federal COVID relief dollars programs that came through, and I will say, I'd be remiss if I didn't mention Congressman Pocan and Senator Baldwin, who both worked very diligently and hard to make sure that that money came to communities so that we could get it out to people who need it. Because we know when you just have a federal program, they're good, they're well-intentioned, but often it takes a long time for those dollars to get through. So, I want to give credit to my congressman and Senator Baldwin for the work that they did on that. So Dane County, because we have a population of over 500,000, qualified for a direct payment of CARES Act dollars. It was this specific program that we benefited from was for larger communities, those of 500,000 or more, and our estimates now we're at about 570,000 in Dane County. So that money that came down is to be used specifically for COVID-related relief and response. And so what we've done is we've looked at areas of greatest need and with an eye toward getting that money into people's pockets, into the community as quickly as possible. So one of the things that we did early on that I don't recall if I mentioned this last time we were here or not. Time kind of gets away from you in a situation like this. But we want to focus on food, shelter, helping our small businesses remain viable, helping employees. So our first initiative out of the gate was a $3 million partnership with Second Harvest Food Bank and our local farmers and growers. Because we have on one side, because of the pandemic, we have farmers and vegetable growers who have product but are having a hard time getting it to market, both because of lower demand from their traditional customers, restaurants, et cetera, and some of the supply chain issues we've been seeing. Then on the other hand, we have unprecedented need in the community from people who are hungry and people who need food. So we put together a $3 million program over the next 90 days where we will supply those dollars to Second Harvest, and they will buy the bulk of their food from local producers So building that bridge between the markets, between the producers and the people who need food, and to get that food out into pantries and out into the community. In addition, we, as you recall, when this first started, we took $800,000 of county money and created a small business relief fund for locally owned businesses. That $800,000, well, $800,000 is certainly, a lot of money when you look at the need that's out there. They went through that, in a week or so. Initially there was much more demand than there were resources, and now there's close to $30 million in asks out there. So while local government, even with CARES Act funding, can't solve every problem and can't fund every single need that's out there, we thought it was important to get a bunch of this money out the door. And so since we already had that program set up with Dane by Local, we put an additional $10 million into that fund to get out to local businesses, just to help them survive, to throw them a lifeline. We know it's not going to make anyone rich, but people are just trying to survive now. And what we want is, when we're on the other side of this, or when we can start opening up again, for as many of our local businesses to be intact as possible, so that they can, so that they don't go under and that they can keep people employed. And related to that, one of the keys, one of the small businesses that are the toughest, that work on the thinnest of margins, are childcare centers. And when we look at the need of people, once we're able to start going back to work again, to get to work, they have to have childcare. So many people, if you don't have that, you can be stuck. And so we have taken $3.5 million of the CARES Act money to create a grant program through which every single one of the approximately 500 licensed daycare providers in the county will receive a grant. And all you have to do is be a licensed provider. That's the only criteria. And the grant size will depend on the size of the provider. The smaller providers will receive $14,000, and then it goes up in gradients, $1,400. Then it goes up in gradients all the way up to $15,000 grants for the larger centers. So what we're trying to do is, again, throw lifelines to people when we're looking at food and shelter, and at the same time help keep as many of these businesses afloat as possible, so that people have a job to go back to when they're able to move forward. Then the one other piece I'll mention with CARES Act funding that's out on the street now is we allocated $700,000 to add an additional 8 employees in the public health department to help with the capacity that's needed for dealing with COVID response. And a number of these folks will be contact tracers. So as we're able to ramp up testing, we can follow to see who folks have been in contact with, and then make sure that they're made aware so that they can quarantine. We have some dollars in there to help people. Say you're identified, you're test positive, and you need to quarantine, but you don't have the ability to do that because of your living situation. We have funding to help people to be able to do that, to bring them food, to help them, with a place to stay, that kind of thing, while they're quarantining. So for the remainder of the dollars, we're working on a number of other programs that are along the lines of food, shelter, helping people who need it most. We are setting aside some of the dollars in case we are able to. There's a debate right now in the federal government. Will local governments be able to use any of that money to help us with some of the deficits that we're incurring? When you look, for example, at county government, we will probably lose in the neighborhood of $25 million, give or take a few, in sales tax revenue alone this year in 2021. And that's potentially devastating. I mean, we are the safety net, a huge piece of the social safety net in our community. And so we need to keep working. We need to be out there to be able to help people during the best of times. And now people who were in challenging situations are facing even more challenges, and people who were doing okay before are not doing okay. So we'll continue to assess that need and try to get that money out there to the folks who need it most, and hopefully be able to use it to make sure that we can continue to provide the services that people depend on.
I know you delayed the property taxes also to October 1st. You're just talking about taxes. Does that impact your revenue coming in? Like, how does that impact? Because you mentioned right now that the other taxes impact you. How does this impact you?
Yeah, property taxes certainly impact. A huge part of our budget is property taxes. So what this one will do is there is a second payment that's due in July if people choose to spread them out. If you're outside the city of Madison actually has a quarterly payment system. So they have a payment due, I believe it's the end of May. And what this did is we have delayed the due date of those payments until October 1st. And what this does is if people are out of work right now, they're short of cash, if they're hopefully temporarily out of work, this gives them a little breathing room so they don't have to come up with that payment. And we would also waive the any fines or interest on that also. So that's where we'll take a slight hit. I should say the one caveat to this is the resolution we passed on the county level allows other like cities, towns, and villages to delay this if they choose. The city of Madison is going to follow through and delay it, as are others. There might be some smaller communities in the county that, for cash flow reasons, just can't delay it. So depending on where you live, if you want to take advantage of this, check with your city, town, or village treasurer to make sure that it's an option.
Yeah, I want to come back because you're talking about the child care program that you have, which I think is wonderful, right? I mean, everyone needs childcare.
Yeah.
This is just me being my political self.
Yeah.
Are you worried about liability? I mean, like, if you're a healthcare provider and a kid gets sick or a worker gets sick, I know they're discussing this at the federal level. Are you concerned about that? Like helping providers open back up and a kid gets sick or employee gets sick with COVID-19.
Sure.
Like, have you guys had those discussions what that might look like?
Yeah. So what this is the child care centers will be allowed to open at a specific time after a specific set of criteria are made, regardless of whether we're going to be helping them out to survive, right? So now there are certain criteria, certain centers are able to provide services for first responders, children's, and that kind of thing. So what we would look at with this is just like any other business or entity in the county, when we get to a point where we can slowly start having people come back, everyone's going to have to follow the same guidelines. So, when we just want to make sure that when it's time to come back, that they still exist, right? And so that they have the financial resources to be able to open up. And this opening up, it will include, I'm sure, social distancing and all sorts of different kinds of practices. But that's a good question. And I mean, and again, it brings back into focus the issue of how important it is to open up when it's safe to open up and not to try to push it, because if it does, we're going to be right back where we started. More people are going to be ill. More people are going to be impacted by this. So, it's tough. It's a tough balance because people are hurting both from the virus and from the incredibly steep economic hardship that it's bringing. So it's heartbreaking, and there's no easy answer.
And so this leads me to my next question. If the governor, Safer at Home, decides to not extend it past, I think, May 26th, and he decides that he's going to open the state back up, I'm guessing the counties or the cities can say, nope, we want to keep our own version of Safer at Home. And I know you extended something, not the Safer at Home part, but you extended something to like July, I think, right?
Yeah.
But so what happens if the governor doesn't extend it? Can you decide that you want to bring your own Safer at Home for Dane County? Even though we're doing Dane County, I would say it's the correct way. Dane County, we still have a lot of people who are impacted, but not as much as the rest of the state, right? Mm-hmm. So we're doing better proportionally. Yeah. But is there something that we can do, that you can do as a county exec, to say, no, I feel like we should extend our own Safer at Home?
Right. Yeah. No, I'm glad you brought that up, Henry, because I appreciate the opportunity to clarify the other order that I extended the other day. So if I could real quickly, so last week I extended the county's declaration of emergency until July 15th. And like you said, the declaration of emergency is something completely different than safer at home. The declaration of emergency is more of an internal declaration that usually you see that happen when there's flooding or a tornado or a natural disaster like that. And it's something that we put in place for a couple of reasons. First, it activates our emergency operations center, where we coordinate all of our emergency response, which we have done for this episode also. But it also, as importantly, it makes us eligible for federal funding, disaster relief funding, particularly from FEMA. And we and all of the local units of government need to document all of our expenses for potential reimbursement. And so that's what the Declaration of Emergency extension was all about. Totally, as you said, it's a totally separate issue from Safer at Home. So Safer at Home, if you recall, and this seems like 100 years ago now, but back when this all first started, Dane County had the first case in the state and the 12th case in the nation. And before other folks in the state, and definitely before a lot in the nation, we put in some local restrictions in Dane County. So what we have done since the governor put in place his restrictions, have put those in a redundant fashion in locally exactly the same as the governor's. Now, a couple of things could happen. They could either expire and he could, decide they've met the statewide metrics and they're going to withdraw. Or, as you know, there's a case between the Supreme Court right now in which legislative Republicans are suing the governor to repeal his statewide safer at home orders. Now, we don't know if they succeed and the Supreme Court overturns those. We don't know what the subsequent orders would look like. Would it be a blanket overturning that doesn't allow local municipalities or units of government or health departments to have their own, or would it be something that allows some local control? Now, the messaging we've heard so far from the Republican side is that their argument is it should be more regional, and that's why they want to repeal statewide. I personally think I understand that argument, but we have to be real careful because viruses don't know borders. And I think statewide is likely the best. That said, given the makeup of the Supreme Court right now, I would not be surprised if they overturned and then if the state's orders. So if they do that and the orders expire and we are still allowed our local control, we will determine when we would undo the safer at home for Dane County according to our criteria for testing and the number of cases and our ability to contain. And what we would do is hopefully be working with, even though it would be at that point a county by county decision, we're in close contact with the counties that surround us, Rock, Columbia, et cetera. Because again, the borders don't, the virus doesn't know the difference between Dane County and Rock County. And places like Rock County, for example, are having quite a significant outbreak now, even higher numbers than Dane County. So it would be my goal at that point to work in a regional fashion, to come to an agreement. We would certainly do what we need to do in Dane County, but then I'd want to come to an agreement with our surrounding counties so that we could agree on criteria and we could remain under safer home until we feel that as a region, it's safe to start dialing it back open.
Yeah. Well, that's true. I mean, Rock County, Janesville, really, that really impacted Janesville.
Yeah. They have more cases than we do, I think, now. They're way up there.
Yeah. Which leads me to as you know, happened in Green Bay, the numbers spiked up there big time. Yeah. And now with Dane County, I think we have about 22 deaths we have, I think, around in Dane County right now. However, though, for at least the Black community, we're about 15% have been infected, I think, about 11% for Latino. That's still a little higher than our population overall.
Yeah.
But comparably to Milwaukee, even Green Bay, we're still lower. What do you think we can continue to do in Dane County to make sure that we bring those numbers down lower and that we can actually always communicate to those communities why important it is to get tested? And I know that you have some testing that you guys are now doing at Alliant Energy Center. So is there ways that people of color can definitely be included in that testing process?
Yep. Yeah, I was looking at the numbers just before the interview, and you're right. While we're doing better than basically anyone. There are still some slight disparities, right? The death, when you look at deaths, it's about the same. It's pretty reflective of the population. But when you look at hospitalizations, it's a little higher. When you look at cases, I believe the last the last numbers I looked at, believe about 20% of the positives were African American, and so that is higher. I mean, it's not as bad as other areas, but it's still higher, and that's not okay. So the two things we have to do is the testing that's beginning at the Alliant Energy Center, the mass testing, is important because we still don't know that if the percentages we're looking at are a true reflection of what's out in the community. So I think the Alliant Energy Center is a good start because anyone can go there. But you still need transportation, right? It's still where it is, and there's going to be a built-in bias to that. So next time I come back on, Henry, I hope to have some more information for you on a few things I'm looking into to try to get better representation of minority communities in our testing. And to be doing more reaching out, because you're right, we can't let that happen here. What's happened elsewhere, and what's really disturbing. Well, I mean, it would take 10 shows to talk about everything that's disturbing on the federal level. But one of the very disturbing things we're starting to see right now from the federal government is some subtle and not so subtle victim blaming. Right? You look at people who work in meatpacking plants and other places where they aren't allowed the proper social distancing, and now you have some people blaming them in some way for bringing it on about themselves, and that's not okay. We as a community need to protect every single person in this community, and so that is, now that we have the testing at the AEC, Alliant Energy Center, it is critical that we continue to drill down. I'm also looking at some potential partnerships for spreading the message in minority communities, especially among communities of youth, to make sure that the word gets out, that they realize, that this thing is real and it can impact them and it can impact folks with whom they come in contact with. And at the same time, we have to look at a community as, how do we want to get the word out for social distancing. How do we support people's ability to do that? If you're not always in a situation where that's the easiest thing to do. So I think, long answer to a short question, we're doing well, but we need to do better. And that will continue to be a focus of mine on how we can drill down deeper into this question and come up with some more action steps.
Yeah, and my guess is the more testing, the numbers are going to go up, right? But that's my guess.
That's an interesting number. I think what we'll see in minority communities, I think you probably will see more because of lack of access. Now, overall, it'll be interesting because up to now, most of the people tested have been people who are symptomatic or healthcare providers, first responders. So it will be very informative once we can get a more valid sample, really, that's more of a random sample of the community. It's more of a representative sample of people who are symptomatic and asymptomatic to really see where we stand. And that's why testing is such an important piece of being able to get back to, dialing back up our economic activity again also.
Yeah. Well, thank you, County Exec, for coming on our show again. Thank
Absolutely.
You for spending the time with us. Hope to have you on again. You're more than welcome to come on as often as you like to update our viewers. And thank you. We'll see you next time in Real Talk.